sensitive? That's all right. So Thomas test, we're looking at the influence of muscles from the hip as they attach down onto the knee. So are these muscles allowing normal length and movement around the knee joint and the structures there, or are they contributing to their problem? So with the Thomas test position, it's really important that you set yourself up that you have clearance of the hip at the edge of the bed. So you can't be in a position where when they lay down, they can't extend their hip, because you're not going to get an idea of what the hip extension is like, you're just going to get an idea of them resting on the bed. So what I would like you to do, you're going to hug your left knee up. We're going to lay you back onto the pillow. Then I'm going to put your foot into the side of my trunk here. Now can you just let go of your knee for a little bit? Okay. So in this position, you can see I can influence the pelvic position by flexing right up, and you can see that posterior pelvic tilt. Or if I let it come down here, you can see that anterior pelvic tilt and the lumbar spine starts to lift off, yeah? So in this position, I want to maintain a neutral femoral or hip rotation, bring up into a neutral lumbar position. So it's going to, that's posteriorly tilted, that's anteriorly tilted, so I just want it here. Now can you hold your knee in that position, but don't pull it any further. So I'm going to get you to control the rotation component, and I'm going to control the flexion component here. But with that position, I then have two hands free to stabilise one end of the muscle and move the distal aspect of the muscle. Now having said that, I'm actually, hold on, I'm just going to pull you down a little. Yep. So I want that hip to be able to extend. Yep, there we go. Okay, so stabilise anterior superior iliac spine, and just for starters, see where that thigh sits. So you can see tightness through that ITB, yeah? It sits a little bit into abduction, little bit into external rotation. Can we see that? So now we want to bring, first of all, into a neutral position of abduction. So that's neutral there. And I want to test hip extension. How are you going there? Good. When I'm assessing, so how much hip extension do we want?
50.
5 to 10? I don't see a lot of people that have that much hip extension, but maybe in the group we'll see more. We can do a consensus after this, okay? All right, so hip extension. Now if you're going to do knee flexion, I want the hip in neutral, okay? Then from here, stabilise at the knee, knee flex. How are you going there? All right. How much knee flexion do we want? About 100 is pretty good. So I'm happy with that. Hip adduction, how much do we want? 10. Yeah, about 10. And with this, like, you rest in a little bit of abduction, but I can quite comfortably get you into 10 without too much worry. And you can also assess in this position hip internal rotation and external rotation, okay? But the key ones, I think, that give you the most information is hip extension, knee flexion, hip adduction. Again, hip adduction, not in an extended position, it's in a neutral position. And then we're going to swap.
Knee flexion?
Yes, so in a hip, so hip extension, knee flexion, you come back to that neutral, flex, and adduction, maintain the neutral adduct, okay? And then we swap over. So we do that one. Let's see what goes on here. So again, we just need to make sure we've got that neutral position. So I'm sitting around here. Stabilise at the iliac crest. Now, what do you think of this leg compared to the other? What do you think of the resting? Yeah, he's got quite a bit of external rotation in this position, hasn't he? Maybe a bit more abduction as well, resting in more abduction. So if that's neutral there, kings out to the side. Okay, so neutral adduction, abduction, hip extension. Does that feel different to you? Same? Yeah. Maybe just a tad tighter from my point of view, but it's fine. Neutral hip extension, knee flexion. Do you feel that more? Yeah. And probably gets to the same range, but the quality of the movement is just tighter. And hip adduction, again, feels tighter on this side compared to the right. Yeah. Hip external rotation, he obviously, he's happy with that. This one, not so much. So again, that might be reflective of some TFL tightness through there. Okay, so that's what I'd like you to practice. Okay, don't fall off.